because she has a $1,500 deductible, she pays $125. Her plan pays $0. But this $125 is deducted from this deductible. So you spend down on your deductible until, again, she chose this $150, this $1,500 deductible. Again, as you know, different health plans have different deductibles. Yeah. Can we wait for questions till the break? Okay. So, more costs. So let's say in the next scenario, Jane has reached her $1,500 deductible, so then coinsurance begins. So she's seen a doctor several times, and she's paid the $1,500 in total. Her plan pays some of the cost for her next visit. So her next visit, the office visit, costs $75. Jane pays 20% of the $75, which is $15. Her plan pays the other 80%, which is $60. So that's the concept of coinsurance, and that's basically what we're showing here. She pays 20%, the plan pays 80%. Again, moving to the next one. Now, Jane has an out-of-pocket limit, you've heard us, and we'll refer to this in a little bit too, of $5,000. She's seen the doctor often and paid the $5,000 in total. Her plan pays the full cost of her covered services for the rest of the year. So, subsequent to this, her office visit costs $200. She pays nothing because she's already paid out her max out-of-pocket. So her plan would pay the $200 office visit. That's called, you've heard us refer to MOOP, or maximum out-of-pocket limit. Another term. So again, these slides here just talk about some of the other terms. What is a claim? What is the allowed amount? We just talked about the maximum amount that's allowed to be paid for a covered service. This might also be called eligible expense, or payment allowance, or negotiated rate. You might see those different terms used. If a provider charges more than the allowed amount, the consumer may have to pay the difference. And we may have all ourselves as healthcare consumers have had to do that as well. This slide here actually talks about something very important, balance billing. Are any of you familiar with the term balance billing? Okay. Let's say, I'm just going to look at this. A provider bills a consumer for the difference between their charge and the amount that's allowed by the health plan. For example, provider charges $100 and the allowed amount $70. The provider may bill the consumer for the remaining $30.